Hello everyone, and welcome back on how to answer NCLEX questions that are priority questions. These set of questions I'm going to be going through now is going to be a little bit more of a emergency medicine type background where you may or may not have heard of these. We have already covered the ABCs, which is airway, breathing, and circulation. Now in emergency medicine, we're going to move on to D, which stands for disabilities. What exactly is going to be disabilities? Well, disability is basically we're going to be looking at the patient's A&O, or alert and oriented status, also known as their LOC, level of consciousness. Anyone that's going to be under and has an altered mental status of any kind is going to be considered a disability. So let's look at our question. All right, so a nurse in the emergency department. Again, we're breaking down our NCLEX questions. The first thing we see here is we have a nurse that's where, what setting? The emergency department. They are caring for a patient who presents with confusion. As soon as you see the word confusion, you need to start thinking we're going into a priority type question. And this means we are now going to be on a priority of D, disabilities. Which action should the nurse prioritize? All right, let's look at our answer choices. A, document the confusion and notify the healthcare provider. Okay. I'm not sure if we're going to consider that as a priority right now, but we'll hold on to that. B, perform a rapid neurological assessment and vital signs to check. All right. C, emits a sedative to calm the patient and reduce agitation. Or D, review the patient's medical history and identify any recent changes. Okay, so when we take a look at this, we have a patient came into the emergency department. If we're going to be looking at our steps as far as the nursing process, was an assessment done to start with? The only thing we know is that there was confusion. So we're probably still going to be the assessment phase for as far as the nursing process. And the confusion, again, is going to bring us to our priority of D. Out of all of these, which one do you think we're going to be doing as a nurse initially? Again, what are we going to prioritize out of all of these? Let's take a look and see. If you pick B, perform a rapid neurological assessment and check vital signs, you are absolutely 100% correct. First thing we're going to do is prioritize is we got to figure out what else is going on with our patients. So we're going to go into the assessment, and again, the priority here is a neurological assessment. Rationale. When a patient presents with confusion, especially in an emergency setting, it's crucial to assess their neurological status and vital signs to identify any potential underlying issues. Confusion can be caused by a range of conditions such as hypoglycemia, infections, neurological events, and a thorough assessment helps to quickly identify the cause and guide for the appropriate intervention. Documentation is important to document, of course, but to document the confusion and notify the healthcare provider are important, but they come after the initial assessment first. You have to know what you're going to tell your doc before you call the doctor and say, hey, we have a person out here who's confused. You need to have a little bit more background information. Administering sedative is not appropriate without understanding the underlying cause of confusion, and reviewing the patient's medical history is also essential, but also should follow the initial assessment. I'm going to be honest with you. Many times I've came down from ICU to a different floor, such as med-surg or whatever. Patient was acting confused to start with and being aggressive. And the first thing nurses do is call and get an order for a sedative. Now we have a patient that is having a severe situation, and we have to do our assessment and kind of determine, well, is it the medication that's causing the issues, or was there already an underlying issue, which I'm assuming there probably was to start with. So it makes trying to figure things out a little bit more difficult. All right. Now, if you're liking these videos, please remember to like, subscribe, share so we can get this information out. And also, please leave a comment on what you would like to see. We have one more in the series for prioritization, which again is going to be considered some emergency medicine going into this. And if you guess we're going on to E, you're absolutely correct. And next video, I'll definitely be discussing that. I'm also starting to think about having some videos on here when it comes to some legal advice. You're working very hard to get your license and you want to maintain it. So I'm thinking about some things when it comes to legalities and protecting your license. I'm also looking at doing some medical or nursing math and making it simple. Just please let me know what your thoughts are. All right. Happy studying, everybody, and I will see you on the next video.